What the heck are, well, screw that. Should cancel that. Darn it! This is embarrassing. You're an embarrassment.
Hey all you cool cats and catsettes. This is your main man dentist coming to you from the couch, the one couch, the only couch, letting you know we're going to learn some beautiful things about teeth today from the comfort of your couch. You're welcome.
What the heck is gum recession? What the heck is a gum graft? Why do dentists and hygienists point this out to you all the time at your dental appointments? Why should you care? All right, so the white part of your tooth that you see in your mouth is covered with something called enamel. It's really strong stuff. It protects your tooth from being sensitive. Your gums are supposed to come up and cover the root of your tooth right up until the point where it starts turning into enamel. Where the enamel starts, that's where the gum tissue should stop, more or less, right? It's slightly more complicated than that, but most of you don't care, so I'm not going to go into the details. For those of you who do care, I'm sorry. So what happens with gum recession? Recession means that the gum tissue has dropped down the root of the tooth and the root of the tooth is exposed. The root of the tooth is not anywhere close to as strong as the crown of the tooth that is covered by enamel. When the root of your tooth gets exposed, it can be more sensitive to cold. It's softer, so it breaks down with dental decay more easily. It also gets eroded by acidic foods and drinks in your diet more easily. Brushing your teeth too hard can also cause the root surfaces to wear away. That's actually one of the things that can cause gum tissue to recede if you brush your teeth too hard. Also, if you have a habit of using chewing tobacco or similar products, there has been some evidence to suggest this can contribute to gum tissue recession. Gum disease, either gingivitis or periodontitis, can also put you at risk for gum tissue recession. Gum disease can cause bone loss, and if you lose bone, you lose gum tissue. That's the support structure around your teeth breaking down, right? It would kind of be like losing the foundation to your house. Not great. Houses and teeth both need foundations. The other thing is, gum recession doesn't hurt, but that doesn't mean it isn't a problem, right? It puts you at risk for bigger issues with your teeth and gums over time. It's also much easier to fix when it's in its early stages. If you let it progress and get worse, it's harder to treat and get a full recovery of the tissue. Having your tooth roots exposed by gum recession is sort of be like a turtle without its shell, right? It's vulnerable. It's like if you had on a long sleeve shirt and you cut off the cuff so that your forearm and wrist were exposed to the cold. That's weird. We want to give you your shell back, you poor naked turtle. We want to cover your cold exposed wrist and forearm back up. There are a few ways to get gum tissue back. Number one would be an epithelial graft. This is the oldest surgical technique used to repair gum tissue recession, and it is still effective. You take gum tissue from one area of the mouth and you use it to cover up the area with recession. Some of the downsides can be that the site you remove the graft from, often the roof of the mouth, can be quite sore after the procedure, and also that the gum tissue color can be a bit of a mismatch in the area you place the graft. Usually these areas aren't that visible in your smile though, so it's not typically something the average person is going to notice. The second option would be a connective tissue graft. I have had this type of gum graft done on me twice. I can say that it is not uncomfortable at all. I took a little ibuprofen the next day or two for some mild soreness, and that was it. The reason this is more comfortable is that the connective tissue layer that the graft is taken from is underneath the top layer of gum tissue. So after your dentist, or more typically your periodontist, that's a dental specialist who focuses on keeping gum and bone tissue in the mouth healthy and repairing gum and bone tissue, after they take the connective tissue they need, they can stitch the top layer of gum tissue back down over the surgical site, and that epithelial tissue protects the donor site from being exposed, so it's more comfortable. The roof of your mouth won't hurt, right? Also, because this type of graft is from a lower layer of tissue, what sort of ends up happening at the graft site is that the epithelial tissue surrounding the graft grows over top of it and you get a much better color match. The tissue blends together better. Most of you probably have no idea what I'm saying when I use the word epithelial, and I'm sorry. Basically, connective tissue graft means that when you put that graft in the new site, it's going to blend in with that tissue very well, and you're going to get something that looks very natural. This is the type of graft you'd want to use if this was an area that showed prominently in your smile. Option 3 would be pinhole surgery. This is a pretty nifty, newish technique in which your dentist makes a small pinhole in your gums above the teeth and then loosens the gum tissue away from the bone so that it can be pulled down over the exposed root surface of the tooth with recession. I'm sorry if that sounds terrifying. It's actually not that bad. You can think of this like pulling the sheets up to cover you more when you're laying in bed, right? You don't have to take tissue away from anywhere else as long as you have the right amount of tissue available above the tooth with recession. You just pull it down into position. Again, a pretty non-invasive, fairly comfortable procedure to have done. You're numb during the procedure, and afterwards the healing isn't too bad. Fourth option. The controversial bonus way you can treat gum tissue recession and root surface erosion. Bonding with dental composite filling material. Why would you do this? Well, not everyone can afford to have gum tissue grafting done. Gum tissue grafting takes a lot of surgical skill and training, so it's more expensive than bonding filling material. Bonding filling material is much faster, easier, and inexpensive by comparison. Now, it should be noted that doesn't mean it is as good as gum tissue grafting. Covering an exposed root with gum tissue restores the tooth and gum tissue to its natural state, right? You're back to a normal, ideal, healthy position. Bonding filling material can protect against further erosion of the root surface, potential nerve exposure, sensitivity, but the lost gum tissue is still a loss of support structure around the tooth. The other thing worth mentioning is that if you bond filling material, the tooth can look artificially long because you have white material extending up higher along the gums. This doesn't really matter if the area doesn't show when you smile, but if it does, then you will likely be better off with a gum tissue graft to have the most natural smile. Weirdly enough, dentists go to war over this stuff in online forums. Periodontists get upset with general dentists for doing bonding for patients on root surfaces with recession and erosion. I always tell patients that the ideal treatment is seeing a periodontist for gum tissue repair. But honestly, most of the patients I see don't want to do that. They're already worried about money coming to see me, so often a dental specialist is way out of their price range. And I get it, I make the recommendation, but they get to choose in the end, and that's how it should be. I'd still rather protect the exposed root with dental bonding if it's eroding away, rather than do nothing and just let it continue to get worse. Don't let the perfect be the enemy of the good, right? I think that's what they say. But if you're a periodontist and what I'm saying makes your blood boil, please feel free to ream me in the comments. Maybe you can convince people why they should get gum grafting done better than I can do it. Maybe you've got a better selling point. So why get a gum graft? It protects your tooth root from decay, erosion, and sensitivity. It helps stabilize your tooth. It looks really nice, so you have a pretty natural smile. People tend to think of their teeth first when they consider their smile, but the positioning and look of your gum tissue has a lot to do with how your smile looks. A periodontist can help you out with that. Some people even have excess gum tissue, and a periodontist can reshape that excess tissue to expose more of your natural teeth and give you a fuller, brighter smile. Believe it or not, it is possible to have too much of a good thing, in this case, gum tissue. So if you feel like you show too much gum tissue when you smile, or your teeth look small to you, maybe you need to talk to your dentist or a periodontist about something called crown lengthening. Some dentists call it gum tissue shortening. If you want to see some of the wacky stuff periodontists are able to do with gum tissue and bone to make your mouth healthier, check out the Instagram account @periodontist.dds. I don't know Dr. Wadamina, but he does have a YouTube channel as well, The Gum Dentist. But anyway, he does a great job documenting his cases, and you should check those out if you're into that kind of thing. Warning, you will see exposed blood and jawbone and stuff like that. It's, cool to me, might be gross to you, I don't know. But if you want to see how the sausage is made, check out his Instagram. Also, if you have gum recession and you want to keep your teeth and gums as healthy as possible while you're saving up and or making time to have gum grafting or composite bonding done to protect your teeth, here are some tips to follow. 1, don't brush too hard. Use a soft bristle toothbrush. Sweep lightly down from the gums on your top teeth and lightly up from the gums on your bottom teeth. Don't scrub side to side across your gum tissue. Number 2, you can use a manual brush as long as you don't push too hard. I have some patients who can't help themselves. They admit this to me. They always scrub hard on their teeth, or else they say it doesn't feel like their teeth are clean. If you're OCD special like that, all right, and sometimes I am too in other areas of life, it's fine, that's cool. But consider getting an electric toothbrush. They make electric brushes now that have sensors that will go off to warn you if you start pushing too hard. You should probably get one of those. Number 3, if you have anything acidic to eat or drink, sodas, juices, fruits, wines, etc., use a straw and or swish with water right afterward. Yes, use a straw with your wine. Any liquid will tend to collect around the rim of gum tissue around a tooth. It has to do with physical chemical properties of water, surface tension. You can look it up if you want. Check out Wikipedia. So if it's an acidic liquid and it's resting up against the roots of your teeth, the roots of the teeth are softer than enamel. They tend to erode more easily and faster. You rinse with water, you flush that acid off of there so it can't sit on it for too long and cause more damage. Number 4, don't suck on lemons. I used to do that as a kid. Bad idea. I have some erosion on my canines up top. In retrospect, I think it might have had something to do with those lemons. Don't suck on lemons. The goal of these videos and the dental health tips playlist on my channel is to set you up for success in a dental office. I know very well the common inefficiencies and costly pitfalls patients run into in dental offices. I want to help you avoid those. I want to set you up to be an ideal dental patient who knows how to find the ideal dental provider for you so that you can have an ideal dental experience. Now, I use the word ideal loosely because things in life go sideways in a hurry all the time. But I want to help decrease the likelihood that that happens to you. I'm a huge proponent of preventative medicine. Most dental problems can be avoided with simple, healthy habits at home. I want to help you build those simple habits to help reduce stress in the dental chair and help you avoid financial strain from healthcare expenses. I have a dental health tips playlist on my channel and linked in the video description. That playlist is full of longer, more in-depth videos to give you guidance on how to avoid dental problems and keep a happier, healthier, more functional smile. By the way, I do stand-up comedy and I enjoy photography. Huh? What? Yeah, yup. Please subscribe to my channel if you want to know more about that. I'll be making videos involving dentistry, comedy, photography, basically anything I enjoy that I also think you will enjoy and find informative. I'm on Instagram at Comedic Exposure. You can check out my website if you want to find future info on comedy shows and albums I plan to produce. That's anotherlazymillennial.com. I'm also on TikTok at Mike the Dentist. Please like, share, subscribe to my brand. I'm not a person anymore, I'm just a brand. Please smell, taste, and feel my brand. It's a good brand. Thank you.